Okay, here's one that's on the minds of a whole lot of people in the city, and that's a hospital expansion. It's something I asked you about, I think, the last time you were here. Now, I know that people are screaming crazy about healthcare right now. Hospital expansion, it's crowded. I mean, I'll give you an example. A pregnant woman cannot give birth in Brooks right now because they don't deliver there, so she has to come here. More crowded. I mean, they need some more space. Is there anything you can say that'll give them some hope?
You're identifying an issue that very important to people living in Medicine Hat, but it's also important for our government.
Right.
And that is to have services in health and for seniors, similar to what other communities have, so that everybody enjoys the same, equitable delivery of healthcare. There was a lot of work done on the planning and design of the expansion, and it was quite a complicated design, but obviously a lot of needs to be served. We set aside money in the capital fund. What has happened is when we went with the one board, the board is reviewing all of the capital, not that they're not going to build, they're reviewing to see how it ties in other providers of healthcare and what facilities are being built in the various area, in the same area. And then we're tying that all into one large capital announcement. We're fully aware of the need, and I know that the Alberta Health Services Board is recognizing it. We have money set aside. We have about $7 billion in cash set aside for capital, and we know that we're getting some very, very good tenders now. We've seen reductions 10, 20%.
Right.
Lately, we've seen reductions as much as 40%.
Right.
So we'll be able to do more with the capital dollars, and I'd like to give this community an answer by the end of this year so that we know where we're going.
That would be excellent. All right, I want to touch a little bit about doctor-patient ratios a little bit and about how overcrowded things are, and I want to bring it back to the Brooks not being able to deliver a baby there, because I think the last time I talked to you, I was telling you that you could not get an epidural there, which to me sounded positively primitive. Not only can you not, you can't deliver there. Well, here in Medicine Hat, you can't generally get an epidural either. So for a woman to go in who's giving birth, if she requests one, doesn't mean she automatically gets one because there aren't enough anesthesiologists. And it begs the question, if you were a female premier, I'm pretty sure you might revisit this, because having given birth both ways, it almost seems people criticize the whole thing because they think we're stepping backwards. Is there, my grander question, I guess, is there a master plan when it comes to healthcare, and what would it look like?
Yes, there is. We have invested significantly in training more Alberta doctors, not bringing in doctors from other countries, but increase space in our medical colleges and universities in Alberta. Secondly, we're still on target by 2012 to graduate 2,000 nurses a year, and that is continuing. That is a huge investment. We want to improve the physician-patient ratio. There are communities that the ratio is quite high, and some doctors cannot deliver or can't accept any more patients. I will say, though, that there are some communities that have gone to what we call a primary care network. Pincher Creek, for example, is one that's leading, and we just visited that community, and it is working excellent. Where a physician is called for, of course, the level of service that the physician will bring, and it's shared with other allied healthcare professionals, whether it be a nurse on site or somebody else in physiotherapy, et cetera, to deliver the program that's required. And talking to the physicians, of course, some communities have taken it on themselves and are moving forward. And these are one of the discussions that we're having presently with the Alberta Medical Association and the college, so that we increase the number of physicians in the province. We have just increased funding to physicians by $1 billion. It's going to be $1 billion over the next 3 years. So it's not that we're not paying them, it's just to train more.
Okay.
And honestly, I got to go back to the late 80s. We were told, and I used to be a member of a health unit board and a hospital board, and we were told that we were training too many doctors right across Canada. And as a result, all colleges restricted the number of spaces available, and funding both provincially and federally right across the country, and now we're paying the price. I can't go back to the late 80s. I don't know who made that projection or why we listened to it, but we know we have an aging population, we have more demand, and we are doing more cardiac surgery, more hip and joint replacement. We're doing more every year. We've also been increasing the budget at least 10% a year. In the last 10 years, just in Alberta, and you asked me why did we do it at $30 barrel oil, about 70? Well, last 10 years, health budget alone increased 180%. When I started in 1993, it was $3.2 billion. Today it's over $13 billion.
Yeah, hard to wrap your mind around.
Yeah, so I'm not saying, and by the way, we're not reducing the budget. It's just there won't be a 10% increase. We're going to find, someplace in between. Last year, it was a $550 million increase to the health budget. And of course, that's shared by the board, more staffing. It doesn't all go to Alberta Health Services Board for delivery, but it also goes to pay doctors and some of the other allied healthcare providers.